Today is a great day because today all of the patients who thought that I was afraid of getting stuck by a needle, you'll be proven wrong. Today we're going to be doing ozone major autohemotherapy on me. I'm the wellness doc. This is ozone MAH. For this procedure, what I'm going to be doing is nurse is going to set up a drip on the hand, one of these veins here. I'm going to drain about 6 tablespoons, roughly 100 mils, into a bag of saline. We'll talk about that in a little while. And then we're going to add the ozone to that blood saline mixture. When we do that, we're going to see some interesting things happen to the blood. Then we're going to return it back to me. Alright, so nurse is going to introduce some heparin just to keep the lines flowing freely. She's adding a little bit to the bag there and getting a little bit of the saline from the bag to make heparin saline. And she's going to add a little bit of that here to get my blood flowing a little bit better. Then we're going to get started. Still having fun. Alright, so at this point, we're gonna allow the blood to flow back into the line. And it's gonna drain into the bag. Alright, so what I'm doing now is I'm just allowing a little bit of my blood. You notice we have the tourniquet on. That keeps my blood flowing out into the line. I'm not feeling any pain. I'm actually enjoying this because I know I'm gonna feel awesome when I'm done. And my blood is leaving my body. It's gonna mix with the saline. Then we're gonna add the ozone to that, and I'm gonna show you something really cool. Then I'm gonna get it back. It's amazing. So it's been 15 minutes since we started. As you can see, I'm still doing pretty well. It's actually been fun. And what I've done so far is I've given 100 mils of blood into the bag of saline, which is here. Nurse has it. All right, so you can see it's mixed with the saline. And now we're gonna get ready to treat the blood with ozone. And then we're gonna put it up and I'm gonna get it back. So that's not all blood, but it's actually a mixture of my blood and saline. Nurse is going to add a little calcium chloride. This is to prepare the blood for the ozone. And then you're going to follow nurse into the room and watch her prepare the ozone treatment. She's going to pull up the ozone gas and bring it back. All right, and we're back. So nurse is going to add the ozone gas directly to the mixture of blood and saline. You notice it bubbling through, so the gas actually bubbles through. All right, and nurse is gonna get a little bit more, and then we're gonna show you something super exciting. Alright, she's adding the rest of the ozone. So in total, she's added 120 mils of ozone. And now I'm going to show you something really exciting about what happens when the ozone comes into contact with the blood. So I want you to watch this very carefully. You'll notice that the blood in the line, the blood in the bag are roughly the same color. But we've added ozone to the blood saline mixture. And so I'm going to gently shake it And I want you to see what's happening right before your very eyes. And the principle about this is that it's an oxidative therapy. So it involves oxygen. And so as the ozone gradually mixes with the blood, you'll notice that the blood is actually starting to become very bright red. And this is a very cool thing because this is what it's going to do in your body as well. It's going to cause the areas that had low levels of oxygen to form peroxide compounds, and ultimately the whole air is going to become extremely oxygenated. All right. So already you can see the difference because it's glowing bright red. And just in case you're doubting me, when I finish mixing it, I'm going to show you what the blood in the line looks like versus the blood in the bag. And for those who thought that I wouldn't do my own treatment, here I am doing my very own treatment on myself, thanks to Clean Nurse JA. All right, I think that should be enough. I'll show you now. Cut the blood in the line. Cut the blood in the bag. Two totally different colors. So this is still pretty much the blood that was in my body. This is the blood that has been treated with ozone. Yeah. And then I'm gonna get back my own blood, which is now ozonated. And so that blood is now rich in oxygen compounds. And when it comes into contact with my regular bloodstream, we're gonna find a whole lot of changes taking place, which will stimulate healing. The reason why I'm doing this is because all of us are exposed to things that would interfere with our healing. I have my own health goals, and so I'm gonna just kind of fast track. I have a 5K coming up, and so I'm gonna fast track my preparation by doing an ozone treatment. When should you do a treatment like this? Well, I use it whenever I have the flu or a cold, or when I'm just feeling like I need a lift to my metabolism. Ozone is good for that. A lot of us are exposed to viral illnesses. It's also very good because ozone, when it comes into contact with viruses, fungi, bacteria, kills them on contact. We use it to modulate the immune system, so for autoimmune diseases, sometimes even for cancer. We use it to help to boost the metabolism and also to help the immune system to do what it needs to do. So it's not a cure for a disease, but it helps the body to regulate a lot better, and it helps healing to begin. So you've seen me do it for myself. If you think you want to try it for yourself, you know how to get in touch with us. Just call us at 876-787-8197 or visit our website at www.teshuvawellnessja.com. I'm the Wellness Doc.
And I'm Clean Nurse.
See you soon.
See you soon.